What epidemiology concepts are on USMLE Step 1? If you are preparing for the United States medical licensing examination, Step 1 and wondering about the epidemiology concepts included, you are in the right place. Understanding these concepts is essential for grasping disease patterns and research methods in medicine. Let's break down what you need to know. First, you will encounter measures of disease frequency. This includes incidence, which refers to the number of new cases of a disease in a population over a specific time frame. Prevalence is another key measure, indicating the proportion of individuals who have a disease at a particular point in time. These measures help you assess the burden of disease in populations. Next, familiarize yourself with the types of epidemiological studies. Observational studies include cohort studies, case control studies, and cross-sectional studies, each designed to investigate associations between exposures and outcomes. Experimental studies, such as randomized controlled trials, test interventions in controlled settings. You will also need to understand measures of association and risk. Relative risk compares disease incidence in exposed versus unexposed groups, primarily used in cohort studies. The odds ratio compares the odds of exposure among cases versus controls, commonly used in case control studies. Attributable risk shows the difference in incidence between exposed and unexposed groups, indicating the excess risk due to exposure. Another important area is the characteristics of screening and diagnostic tests. Sensitivity measures a test's ability to correctly identify those with the disease, while specificity measures its ability to identify those without the disease. Positive predictive value and negative predictive value indicate the probabilities that positive or negative test results are accurate. Bias and confounding are critical concepts as well. Bias refers to systematic errors in study design or data collection that distort results. Confounding occurs when an extraneous factor is linked to both exposure and outcome, potentially misleading the association. Randomization and blinding are methods used to minimize bias and confounding in experimental studies. Understanding causation versus association is vital. You will need to differentiate between a true causal relationship and mere statistical association, using criteria such as temporality, strength, consistency, and biological plausibility. The epidemiological triad is another foundational concept. It describes the interaction of agent, host, and environment in disease development, especially in infectious disease epidemiology. Health status indicators and population health metrics are also covered. Mortality rates, morbidity rates, case fatality rates, quality-adjusted life years, disability-adjusted life years, and standardized mortality ratios help quantify the impact of diseases on populations. Additionally, disease surveillance and outbreak investigation concepts are important. This includes understanding attack rates, herd immunity, and points of intervention such as primary, secondary, tertiary, and quaternary prevention. Lastly, you will encounter statistical concepts relevant to epidemiology. Knowing about p-values, confidence intervals, and types of error is essential for interpreting study results. In practical terms, for the United States medical licensing examination Step 1, you will be expected to interpret study designs and calculate measures like incidence, prevalence, relative risk, odds ratio, sensitivity, and specificity. Questions often requiring applying these concepts to clinical scenarios, so problem-solving skills are key. Mastering these epidemiology topics will support your understanding of evidence-based medicine and clinical decision-making, which are central to the examination's focus on basic science principles applied to patient care.